Okay. The next examination is of the heart. I will move on to assessing the jugular vein, and I'm noting that there is a soft undulating pulsation of the jugular vein. I'm not noting any distension or any bulging of the jugular vein. Looking now at the precordium of Rob. Rob, let me just put that. I'm noting for any obvious pulsation, any heaves or lifts, and I note that there are none. I'm not noticing anything. Moving on now to the pulsation of the precordium. While palpating the precordium, I'm going to ask Rob to tell me if there's any tenderness, okay?
Okay.
Is that tender?
It's not.
Is that tender?
No.
Okay. And I noted that there are no obvious pulsations in the precordium. Now I will use the ball of my hand to palpate. I'm trying to feel for any obvious thrills on those same location, and I know that there are no obvious thrills. Now I will check the apical impulse, and I will use the pads of my fingers and I'm noting that it is approximately 1 centimeter, and it is short in duration and small in amplitude. I already mentioned that Rob's heart rate when we begin the examination is around 73 beats per minute, and it is regular without any irregular beats. Okay, now I want to auscultate the heart sounds. The aortic, I'm making note here that S1 is louder than S2. There are no S3, S4 rubs or murmurs. Now I will use the bell of my stethoscope to detect any murmur. There is no murmur. There is no murmur. There is no murmur. If I have a concern of mitral murmur, what I'm going to do is I'm going to ask Rob to turn to his side. Rob, can you turn to his side? And with the use of the bell of my stethoscope, I will try to listen for the mitral murmur. And I did not hear any mitral murmur. If I have a concern of an aortic murmur, I'm going to ask Rob to lean forward slightly. And when as he exhales completely, Rob, please exhale. I did not hear any aortic murmur. The next examination is the peripheral vascular exam. I will begin with the temporal arteries. is 2 plus and equal bilaterally. Now I will assess the brachial artery. It's 2 plus and equal bilaterally. The radial artery. It's 2 plus and equal bilaterally. Now the popliteal artery. Pulses are present and equal bilaterally. It is 2 plus. Now the dorsalis pedis. It's 2 plus and equal bilaterally. Now the posterior tibialis. It's 2 plus and equal bilaterally. Pulses are all present.